Our vision for addressing health in the future is to work as one, which is the first three words of our mission statement. And by that we mean getting our staff in our primary care practices, which are now being transformed into what are known as patient-centered medical homes, to work more closely with their specialists in co-managing patients' problems. And then when patients do need hospital care, that the care in the hospital is better coordinated back with their medical home. We're changing the concept of what it means to go to a doctor's visit. We used to think that that meant just the time that we'd spend interacting doctor-patient. In the future, we think it's going to mean that individuals will spend time with social workers, with nurses, with dietitians, with exercise physiologists, all aligned with the interests of the physician, all working closely with the physician to help better manage the patient. It's common when patients are leaving the hospital to use the phrase, "we're discharging you." It's a phrase that I've been suggesting we may need to rethink. And instead of saying, "we're discharging you," we need to be using language such as, "we think you're ready to go home, but we're not done with you yet. And we might not be done with you for 30 days or 90 days or even for the rest of your life, because you may have a chronic illness that if we don't work together, you might end up back in the hospital. If you had an acute illness that brought you into the hospital, they're going home very quickly, 3 or 4 days. They're probably not completely well, and they're still going to need close follow-up in that post-hospital period. We want to stay with them until they're completely well. And then when they are well, if we've cured their acute illness, we want to keep them well. That means never discharging a patient. They're always with us, partners with us. WellSpan intends to take a leadership role in changing how we deliver health care. We think we've got the talent, we've got the drive, and we've got the capacity to fundamentally change how health care is delivered in our community.